Have you been feeling bloated and sluggish, constipated, or having irritable bowels and just not feeling yourself? If so, it may be time to take a closer look at your gut health. That's right, your gut plays a very important role in your overall health and well being. And we're excited that for our 8-year anniversary, we're going to be interviewing Joel Williams, who is a naturopathic practitioner that specializes in colon hydrotherapy. Stay tuned to learn more about why your gut
Awesome.
matters. Hello, everyone. This is Dr. B from the Wellness and Peas. I am a board certified nurse practitioner specializing in hormone optimization, menopause management, and medical weight loss. I'm also the president and CEO of the Wellness and Peas, and I am super excited to be celebrating our 8-year anniversary. That's right, our practice has been in business 8 years. We've been servicing our community, and as part of our anniversary, we're doing a special series focused on helping you feel more balanced, more energized, and more confident in your body as you age. Now, one thing that's really important to me and something I want you to know about this series is that many of the topics we'll be discussing are actually based on treatments that and health services that I personally use. So, to help me stay healthy, balanced, especially as I prepare to enter my fifth decade of life, that's right, I'm going to be turning 50. My goal is to age gracefully as I get older. So, you're not just going to be getting theory, you'll be getting real life personal experiences from me along with my clinical insight. Now, today's topic might make some people a little uncomfortable, but it's something that we really need to talk about. It's extremely important, and that is our gut health. That's right, our gut, GUT health. And I'll be honest with you, I've personally been incorporating with colon hydrotherapy into my wellness routine for the past couple of years. And I've seen some great benefits. So I want to bring in an expert to really break this down the right way. So today I'm joined by Joel Williams, who's a naturopathic practitioner and he specializes in colon hydrotherapy. He owns a practice called the Hill Wellness Center. He has a practice that's currently located in Newark, Delaware, and he recently opened another location here in Maryland, where I'm located, just in Columbia, Maryland. He has been a naturopathic practitioner for 15 years now, and I want to thank Joel for joining me today. I'm really excited to talk with you. I've been coming to your practice for the past several years, and I can say I really have had some great results. And I thought, who best to start off our talk with someone who has been helping me with some of my issues and trying to get my gut straight. And so I want to just ask you now to maybe tell us a little bit more about yourself, your background. What made you decide to go into this field, and a little bit more about what exactly is colon hydrotherapy?
Okay. Well, thank you, Dr. B, for inviting me. Um, well, I'm in this business. It's in the family. My father, he has his doctorate in naturopathy. He had a wellness center, and it was three generations there. My grandfather, my father, myself, and my sisters. And he helped so many people. I'm the youngest of five, and I really took to it. He was more putting together protocols, and he was well versed in supplements and homeopathy. um, I kind of leaned more towards gut health. When he sent me away to training, I worked with some great practitioners, and one of the practitioners I worked with, his name was Dr. Bernard Jensen. I went to his wellness center in Escondido, California. He wrote the book on bowel management, bowel care, and I just really took to it and studied it, and just had just a strong desire to learn more about the gut. This was about 15 years ago when I got started with this, and now everyone talks about gut health. Everyone talks about probiotics, prebiotics, postbiotics, and um, it's exciting to see that it's now at the forefront of a lot of people's health. But there's also some confusion with it. Um,
Mhm.
as far as colon hydrotherapy, I, uh, I was sending clients that I was working with. I was putting together protocols for my clients. This was in Philadelphia. and I would send them to a local colon hydrotherapist. And I just noticed that the results were like amazing. That it was people were achieving their goals a lot faster when we were including colon hydrotherapy into it. But there were some things that I had concerns about, and one of them was making sure that after a person had their session, that they were getting that good bacteria put back into their gut. Um, so I ended up opening up my first location in Delaware, and we've been there for 10 years now, and just recently, we expanded into, as you mentioned, Columbia, Maryland.
Interesting. Okay. All right. So, for people who may not understand what colon hydrotherapy is, I wanted to provide them with a picture just so you can kind of get a sense of what the actual equipment looks like. And then you can walk us through what we're looking at and then how it works.
Yeah. So, well, the good thing is the new machines they're pretty cool looking. They used to be um, pretty intense and intimidating. This is comfortable. The way it shapes and where you sit, that black thing that you see going across the pad, that's actually a heating pad. When you come into our center, that pad goes on your lower back. That's why it's located there, because that's where your kidneys are, and your large intestinal tract is closer to the lower back. Um, Right there, there's laying across below the black pad is the actual nozzle. It's not connected yet, but it's very thin. It's smaller than a number 2 pencil, that you insert into the rectum. You do everything yourself. We show you what to do. It's
Mhm.
not painful. Um, the uncomfortability of insertion may last for like 2, 3 seconds, and then you cover yourself. No one bothers you. The water is filling up in your colon. It's capturing stool, mucus, the things that are located in that large intestinal tract that sometimes get backed up or clogged, and it just releases out. During that whole session, that water is gently flowing into the large intestinal tract, then releasing out. So, and it's comfortable. The table, a lot of people come in, they're listening to music. Some people are doing work, which I tell them, don't do any work, like really just relax during this time frame. But it's not something that is causing you to be in excruciating pain where you can't even focus. I come in, people are watching sports and listening to music or whatever. It's actually a pretty comfortable experience.
Yeah, I've had it done. I definitely can say, for my session, I'm on my phone, of course. I'm either listening to a little book online or some music. Sometimes I may fall asleep while I'm in there. And it definitely is it's very calm the way you have it set up. The lights are dim. And it doesn't smell. You'd think that with all that going on, there's not a really bad odor or anything that you notice. It's a very calming, relaxing experience for as much as for the times that I've had it done. So definitely. Can you tell us a little bit what's the difference between having colon hydrotherapy versus an enema?
So, an enema is it's a one-time deal. If you insert an enema, it's going to stimulate what's in what they call the descending colon. That's on the left side. So if you have some waste matter there, you have something that you feel like it's pressure going on near the rectum area and it's fecal matter and you want to get it out, an
Mhm.
enema can help. Colon hydrotherapy is different. That water flows through the whole large intestinal tract. The whole large intestinal tract can range from 5 to 7 feet. You got a lot of intestinal tract down there. You got the ascending colon on the right. You got the transverse colon that goes across, and the descending colon that goes down. So, enema is more on the focus of what's at the bottom or the towards the end of the large intestinal tract. Colon hydrotherapy focuses on the whole large intestinal tract.
Okay. All right. That's interesting to know, especially knowing that 5 feet, 5 to 7 feet is how long our intestines. You kind of think trying to figure out where is all of this wrapped up in
And
our
that's
stomach.
just the large intestines. The small intestines can be up to 15 feet.
Wow. Wow. Okay. So I'm sure people want to know, is this safe? Because there's a lot of miseducation about colon hydrotherapy. Is it safe? Who should use it? Who should not use it? Tell us a
Yeah,
little.
so I mean, there's two things, and and I've made sure to cover it in my practice. One of the things that can be a place where people can say it's not safe is um, if I insert or a puncturing of the lining, or in the rectum area. You've experienced this as well. I've chosen, and I had to go through a lot to make it work, but I've chosen a super thin nozzle. It's flexible, smaller than a number two pencil. There's literally absolutely no way where you can puncture your rectum area with
Mhm.
this nozzle because of the type that I've used. Some of them are a little bit larger in different places. Some of them are more firm. I went with something small and flexible, so that's one of the things that people have concern with. And then the biggest one, and sometimes I'll hear clients will come in and say, "I talked to my doctor, and they said be careful because if I do colon hydrotherapy, it's going to wash away all my good bacteria." That's the main one that I get. So
I hear.
here's the thing with that. First of all, um, majority of the clients that come in for the first time, and they haven't experienced colon hydrotherapy, they're so backed up and there's so much mucus and bad bacteria in there. The furthest thing that's going to happen is that you're going to be losing good bacteria. You're releasing a lot of fecal matter. You're kind of clearing out that waste that's been sitting there a long time. The concern of losing good bacteria might be for someone that has healthy bowels that move once or twice a day. They eat perfect, they drink water, they don't have any gut issues. And then yes, if they come in and do multiple sessions, there's a possibility of that. But we cover you because of the fact that we give you the probiotic drink afterwards, which has over 400 billion CFUs of lactobacillus. We have a prebiotic in there, so we want to cover you. And I want to finally say this regarding this issue. There's so much things that happen on a daily basis that can affect that gut biome. Stress, sugar, exercise, the fluctuations in gut biome happen through like the hour. Like literally, we can lose good bacteria through a strenuous workout. We can lose good bacteria through not getting good sleep at night. There's so many things that affect it. So I feel like colon hydrotherapy kind of gets a bad rap, like, oh, it's just going to get rid of or affect your gut biome. Man, there's so much stuff that affects your gut biome. But we do a good job as far as making sure, and you've experienced it, we give you the drink afterwards to start to repopulate that area with good bacteria.
All right. And then do you have people that you usually say may not be a good candidate versus people who are good candidates for doing it, or is it pretty much generally anyone can do colon hydrotherapy?
Yeah, I mean, I the biggest thing is if a client calls me up and says, "Listen, I'm in a lot of pain in in the abdominal area, or I'm feeling a lot of pressure." If somebody has just had an operation and they're just feeling pain or pressure, do not come in. I won't even allow. That's one of the number one question I ask. Are you experiencing any pain in the lower abdomen area? Inflammation, I don't recommend it at all. Um, I'm trying to think what else. That's really one of the main questions that I ask. Our preparation, like what we tell our clients to do to prepare for their session before and after, really kind of covers a lot of issues that a person can have if they have a colon hydrotherapy session and it causes some type of negative response. We kind of cover that with our prep.
What would you say some of the I want to come back a little bit because you talked about biome and microbiome. I personally am realizing through my own journey studying as a healthcare professional, especially with our patients who are struggling with weight, that there is some correlation with the gut microbiome, and also issues with weight. So I want to come back to the microbiome because some people may not be familiar with that. But what are some of the biggest benefits that people will see as a result of doing a colon hydrotherapy session or a series of that?
Yeah, so colon hydrotherapy session, it's a reset. You know, a lot of times the my clients will come in and they are literally bloated, constipated, and they just need a reset. They need to clean out, and when I say clean out, get all that bacteria the bacteria that is not beneficial for the body or gives creates a negative response like parasites, like candida. Flush that stuff out of your system. That's what colon hydrotherapy does. That water goes in there and it's pulling it out. Whatever's going on in there, it's coming out, good and bad. But then the part of the gut biome is that it kind of clears the area. It's kind of like clearing a foundation so that you can rebuild. So you can start eating better, eating um, vegetables, raw fruit, drinking juices, taking probiotics so that the good bacteria can begin to replicate and grow. So colon hydrotherapy, that kind of is the part of demolition. It cleans out everything and helps you get a fresh start again. So, we'll tell a client, do a series of some sessions to help the demolition process. And then during that time, we're just creating the environment for that gut biome through food and through supplementation to begin to grow. And the
Mhm.
beneficial increases, the bacteria that's not beneficial decreases.
Can the treatments, can it help with bloating, digestion, maybe help with their energy levels? Have you found, patients who are coming in reporting any benefits with that from those
Yeah, the
components?
yeah, the bloating is pretty immediate, because a lot of times with bloating, it just comes from the body having a negative response to food, or the food is sitting, um, in the gastrointestinal tract and it's not moving, so it creates a bloat. So just the fact of movement, of getting those bowels out of you will lower the bloat. Also, just the fact of as it relates to energy, after your session, a lot of people will say that they're tired. They just want to get some rest. And then that next morning, they wake up and they're like, man, I feel amazing. So, yeah, when you're releasing a large amount of bacteria, a large amount of fecal matter in a very short period of time, in 40 to 55 minutes, it's like a consolidated detox. You're going to feel a little bit tired after your session. Now, I do have some people that say, listen, man, I feel really good and energized, but majority of people feel a little tired directly after their session, and then once they get a little rest, they wake up in the morning, they feel better than they felt in a long time.
Very interesting. Okay. Let's see. So I specialize in medical weight loss. A lot of our patients are using the GLP-1s, and
Yes.
oftentimes a big issue for them they complain of is constipation. Before I go into talking about GLP-1s, I want if you do you can you tell us what is constipation? What would constitute constipation? Sometimes when I screen my patient, I'll ask, are they constipated? They say no. But when I ask how often they have bowel movements, they say, oh, I have one a bowel movement every 4 days or once a week, or like, what would you consider to be constipation? Just for the general public, so we all know how often we should be having bowel movements.
Yeah. So food, it comes into food and how long it takes to digest food. At the worst case scenario, red meat. Red meat can take up to 18 to 24 hours to digest. Fruits and vegetables, can be processed in less than 6 hours. Fish, 6 to 8 hours. So, you should be having at least 1 bowel movement every day. If you look at the circadian clock, in the morning is when our bowels should be moving. We should wake up in the morning and have a bowel movement. Um, then there's the other side where I'll have some of my clients, they say, "Oh, I move my bowels after every meal." That's a problem because there's time to process food. We're supposed to digest food and process. So you can be dealing with IBS. IBS clients move their bowels too many times a day. So you should be at least having 1 bowel movement in the morning. That is my goal with my clients. I want you to have a healthy bowel movement in the morning where you feel like you've just emptied out. Anything outside of that is a spectrum of constipation, depending
Okay.
on moving your bowels every 4 days. I mean, you're kinda leaning towards becoming septic. That's
Mhm.
dangerous because it's
Okay.
sitting, and when it sits, bad bacteria grows.
Okay. And then for those who may not be familiar with IBS, that's irritable bowel syndrome.
Yes.
So then let me transition to the GLP ones, right? So these are medications like Ozempic and Mounjaro, Zepbound, Wegovy, things that can help with weight loss, also help with blood sugar control, diabetes. This is something that many people are using now. And we of course have been having issues with that constipation. Do you find and having issues with the gut and the gut motility? Do you find that colon hydrotherapy can be beneficial for people who are using the GLP ones?
Yeah, that has become a major part of people's program when they're on their GLP-1s. They'll come see me maybe once a month. We'll create some type of program that works for them. A lot of times we'll put them on a probiotic that also helps. But yeah, it's because these GLP-1s are working. I've seen amazing things happen with my clients. But the complaint is, man, my bowels, something just is a little off with that. So they do the colon hydrotherapy. I don't allow any of my clients to abuse it, but we will. I want to find out while you're on a GLP-1 or while my client's on a GLP-1, how long do we have to go or how long can we go until you have to do a session? For some clients, they do it every 2 weeks and it helps. They feel good. Other clients, it might be once a month. Some clients, it's bi-monthly, every other month. So, but bottom line is to keep your bowels moving during that time and to stimulate contraction. So I wanted to mention that real quick, Doc. So with the motility issue, the digestive tract from the esophagus to the rectum, it functions through contractions. It's muscle contractions.
Mhm.
So sometimes the GLP-1s can slow that process down because they slow down the contractions. Where colon hydrotherapy comes in and why it's beneficial during this time frame is when that water enters into the large intestinal tract. I'll tell my clients, and you know this as well, hold it. And when you're holding it, it's building up those muscles in the contraction. So the first session, a client may only be able to hold that water for 10 seconds. After their second or third session, they can hold the water for up to 60 seconds or even up to 2 minutes because they're strengthening. So it's helping during that process. There's not much I would probably say that's one of the main things with the GLP-1 is just the motility, the contractions, and colon hydrotherapy helps with muscle contractions.
So how many sessions, if you did have someone who was really backed up and hadn't had bowel, just not having regular bowel movements, having all the bloating, the GI issues, indigestion, reflux, just all these different issues as a result, how many sessions, is it something that they do just once, or do you recommend them do a series? Like how often would you recommend people do it to really kind of get them cleaned out a little bit?
Yeah, the baseline is 4 sessions, and I tell them do 1 session a week, for 4 weeks. It kinda falls into, 21 days, like day 1, day 7, day 14, day 21. That's like introduction. That gets you cleaned out, helps you start contracting and helps build up muscles. And then it also kind of clears the way for you to begin taking probiotics and for them to populate in the gastrointestinal tract because you've gotten rid of a lot of the debris there. So I normally say 4 sessions. Some clients are different. I'm a big fan of why. Like, when you come into a session or come to do a session, it's because it's a response to something you're doing. Bottom line is we wanna push any type of toxins, anything, we wanna get it into the large intestinal tract. So I'll have clients on a liver detox. I have clients on a bronchial lung detox, and the whole goal is we're pushing things in the large intestinal tract. I'll tell clients before your session, do a raw food diet, um, eat something good, do something good, take probiotics, and then when you come in for your session, you're pushing out what's been pushed into the large intestines, you're releasing it out. So it's everyone's different. But one thing, as I said earlier, I don't believe in abusing it, and I really deter my clients from doing it. But I want them to do it as a response to something good they're doing. Not, hey, I just came from a cruise and I overate, and I want to come in and do some sessions. That's not. It actually won't even work. It
Mhm.
won't even work.
Is it possible for people, since we're kind of talking about abuse, for people to become dependent on it, similar to like if people are using laxatives all the time, their body starts to become dependent in order to have bowel movements? Can that occur with the colon hydrotherapy as well?
Definitely.
Okay, okay. So we do
Yeah.
have to be mindful how
Yeah, you
often.
have to yeah, you because at that point when a client is overdoing it, or if I mean, I've never experienced this myself because I won't allow it. I really won't. I'll hear some places will say, oh, do 3, 4 sessions back to back to back to back. I can't see how that's beneficial for
Mhm.
the gastrointestinal tract. This is really these sessions are like I said, to clean out the large intestinal tract, create contractions to help you move your bowels on their own, not to be dependent on it. So yeah, I'm really not a fan of folks that are doing sessions once a week for months and months. I just can't see the benefit of that.
Yeah, definitely. I want to jump into some about things that we can habits we can do to support the colon. But before I do that, something that I found really interesting when I came in was that you offered the option to actually examine the stool, which looks sounds a little gross. But you came in when I was on my doing my session, collected a couple of a specimen, put it in a little container, and then you went out and I think you looked at it underneath the microscope. Can you
Yeah.
tell us a bit about that process, and then what exactly are you looking for, and what type of results do people typically see, and what you recommend based on some of the results that are common after you do the stool testing?
Yeah, th it that's the fun part for me. That's what I enjoy. I know
What?
it sounds crazy looking at stool because it tells the story. It tells you what's going on, and a lot of times it's just instinctually, like, we move our bowels at home, we'll look in the toilet just to take a look at it. We may not know what we're looking at, but we still look to see there's some things we know when our bowels are healthy. We know what they look like, and we know the feeling of a healthy bowel movement. For me, with looking at stool under a microscope, a lot of people misdiagnose what's going on. I see so much stuff on, like, social media or Instagram, and it'll show, "Oh, I release bowels, and that looks like a parasite." Majority of the parasites are microscopic. When I look at bowels under a microscope, I'm looking for condition, damage. If I see that the bowels are oily, they're smearing in the toilet, things like that, that lets me know that there's a big chance that there's some parasite activity. I can see what if the bowels have white specks in them, it'll lead me to Candida albicans, which is white. If it's a little darker in color, it means that the Candida is dormant. So there's certain things that I'm looking for in the bowels that can tell a story. I look at the color, I look at the mucus that's in there, and really the only way I can really see that is microscopic. And I have to get a sample, not just a little smear. I go in there with the little medical tube and get a whole sample of it, and we're looking at it under a microscope. And we also do the saliva test. The saliva test is the mouth is the beginning of the digestive tract. So I want to see the nitrates in the mouth. I want to see nitric oxide production. I want to see uh, prebiotics, probiotics. It starts in the mouth. How's the bacteria in the mouth? There's a lot of people are into like oil pooling because it's really healthy and it regulates the bacteria in the mouth. So we do the saliva sample, which is the beginning of the digestive tract, and then we look at the fecal matter in the stool, which is at the end of the digestive tract, and that normally can tell a story of what's going on with a person.
So, if people that are listening today want some tips on things they can do to help support and build a healthy colon, what types of things can we do to help support our colon or to heal our colon, especially with some of the tests when you're looking at it, you see all these different issues going on. Like, what kind of things will you recommend that your clients do to help their gut?
That's a that's a great question. I say that's a good question because I as I said, I grew up. My father was in this business. I work with a lot of practitioners. There's a part where we had the training that harsh things, harsh herbs, things like that. Um, I'll think of some probably
What
as we
about
talk.
bitters? Are you
Yeah, yeah,
okay.
but even some type there. I mean, there's things out there that create almost like a laxative effect. We think that things that create a laxative effect is the proper way to build up and strengthen the bowels. And in my experience and what I do and what I tell people, if there's something you wanna do even at home to build up your bowels and make sure that gut biome is balanced, is good. Good things, good probiotics. Um, every people say, "Well, what's a good detox? What's a good supplement?" One of the best detoxes is, 3 days of a raw food diet.
Mm,
Good things, things that are good. Like I said, probiotics. Probiotics, they're good for your body. I get so many results with that. I used to be, like I said, in a thing of some of these harsh herbs and laxatives, smooth move tea, and they send us to the bathroom and we're flushing and we can't even control our bowels. Sometimes we don't make it. That's not that's not the proper way to heal the gastrointestinal tract. It's just not. So, to answer your question, my goal is to get people to where they're doing good things, eating good foods, taking good probiotics, things that are beneficial to build up the gut, not things that just tear it down.
yeah, I have been just, like I said, doing research, and I wanted to have this conversation with you because what we're finding is science is starting to realize how important our gut and our microbiome and that good bacteria plays how much of an important role it plays on our immune system, our mental health. I wanted to tie in if you could talk a little bit about how this ties into the hormones because our practice is hormone balancing, but how that plays and how does our gut play into our hormones and balancing of the hormones?
Yeah. Well, real quick, just to address the immune system, the scientific studies are in 80% of your immune system is located in your gut. The gut produces over 20 hormones. One of the major ones is serotonin. 95% of serotonin is produced in the gut. Serotonin regulates your mood, regulates digestion, um, metabolism. I tell folks, metabolism, we think of metabolism as just this, energy term. Metabolism is digestion. It's breaking down food so we can utilize it as energy. So that gut biome has to be right. It has to have a nice balance to it. They say 80-20, maybe 70-30, meaning 70% beneficial bacteria, 30% unbeneficial bacteria, or bacteria that may break down, which plays an important role in your body as well. I say that like parasites, people
Mhm.
say come in and they'll say, I want to get rid of I don't want any parasites. No, you need parasites. They're important. They eat away at the things that shouldn't be in the gastrointestinal tract. They're actually a very important part of it. Yeah, if there's too many of them, then they do what parasites do. They eat away at everything, good and bad. But back to what you were saying, like hormonally, yes, majority of these major hormones that regulate mood, that regulate digestion and metabolism are produced in the gut. And then
Mhm.
they call it the gut brain axis.
Right, right, right. And that's one of the reasons also I always just strongly encourage people. I mean, antibiotics are rampant, and oftentimes as the provider, we were trained in the beginning, like earlier decades ago, to give antibiotics when people were sick. But not everything, especially viruses, do not require antibiotics. And if it's at all possible, I just encourage people try to limit your antibiotic use if at all possible and let your body do the best it can to fight because when you do give yourself antibiotics, what happens is you're killing the good and the bad bacteria, and you have dysbiosis or
Yeah,
unregulated bad bacteria oftentimes is growing in the gut and it throws everything off. And it takes a long time sometimes to regrow that good microbiome when you're constantly doing antibiotics. And if you do an antibiotic, definitely you want to behind it be taking a probiotic and a prebiotic to
yeah,
help build that good bacteria because as Joel mentioned, really all disease starts in the gut. And if our gut is sick, if it doesn't have a balanced microbiome, especially with that good biome, microbiome to that for our defense system, that's when we start to have a lot of things start to break down and get sick and we have different illnesses. So I definitely hope that this has been beneficial. I want to thank you so much for taking the time to talk to us about the
Yeah, thank
importance
you.
of having a good gut health, walking us through what a colon hydrotherapy session looks like. I definitely have had some great experience and benefits from my sessions. Um, it was a really great conversation. And
Yeah,
so, in celebration of our 8-year anniversary at the Wellness and Peace, Joel is offering at Hillwell, the Hill Wellness Center, is offering a special rate on colonic series for our patients. If you're feeling bloated or sluggish, struggling with weight loss, or just not like yourself, it may be time to take a closer look at your gut health. We have a special promotion. Joel, what was it that you were offering?
so we're
Our
going to yeah, we're doing our 4-session package with the stool and saliva analysis, for 248 at, 8 representing your anniversary, but it's 15% off of our regular price, so it'll only be 248. That is 4 of our we call them the deep cleanse sessions. They're the 60-minute sessions, followed up with a, post probiotic drink, and then about the second session, we'll do the stool and saliva analysis and provide a report for you with a protocol.
And that report, I did get mine. I know we're going to be talking about my results, but just seeing the whole breakdown of my protocol, that's
Yeah,
something I've been trying to work on is getting my gut healthy to fight off different disease processes, to feel better, to get rid of all the bloating, the constipation. And I was really impressed by just the protocols that you came up or you prescribed for me to use. And I highly recommend anyone who's been thinking about it, take advantage of this promotion, especially with him being able to look at your gut to see how healthy it is or not healthy and what things you can do to improve that gut health. So, also, if you're looking to lose weight, feel better. Actually, before I do that, there is a special code that we should be using. So, anyone who decides that they want to take advantage of the special, it's just give him a call. You can put his contact information up and the code to use when you call to ask about the fourth series, the 4-part series. It's TWNPS 8. TWNPS 8 is our anniversary promotional code, and that applies to him. It also applies to the Wellness and Peas. If you're looking to lose weight, looking to do hormone optimization or procedures, 15% off of our services as well, our injections, our procedures. You can call our office to get scheduled for that. But our goal and our hope with this talk is just to give you a little bit more enlightenment of some of the services that I do, which includes the colon hydrotherapy. Um, Remember, your health is your wealth. And without it, there is no pursuit of any other wealth. So stay tuned and we'll see you the next time. Thank you again for visiting and listening to our series. Happy anniversary again to the Wellness and Peas, and we'll see you next time.
take care.